Hello everyone, my name is Ken Choinka. I supervise therapy services here at the hospital, and I am also the chairperson for Safe Patient Handling. What I'd like to talk to you about today is patient repositioning. Why should this be important to you? Number one, it's our most common patient handling related injury over the past 5 years in our hospital. We have had 109 patient handling related injuries, and these are injuries to our staff. 109 patient handling injuries over the last 5 years, and of those 109, or 35% of them, have been patient repositioning injuries. So that's why I feel this is an important topic to cover. It's our most common patient handling activity that we perform on a daily basis. And we've seen injuries that have included hand injuries, wrist injuries, elbow injuries, shoulder injuries, back injuries, and knee injuries. So no part of your body is safe when you're doing this procedure. So there are some things that we can do to make sure we're eliminating or at least decreasing the risk of injury when we're doing this procedure. Number one, you want to get a partner. This is always a two-person task. You want to adjust the bed height, which I've already done here, to about your waist level. It could actually come up a little bit more for me. You want to lower the bed rails and move any furniture that might be in your way out of your way. We don't want you reaching over things like bed rails or over bedside tables to perform this task. If you do that, you're already putting yourself at risk of injury. You want to ensure that the patient is correctly positioned on the slide sheet. We have slide sheets here in our ministry. These are part of every bed makeup. EVS puts these on every bed when they clean a room after a patient's been discharged. They're only good though if they're correctly positioned under the patient, and they should run from about the mid-thigh up to the top of the shoulders of the patient. So again, if they're not on this device, it's not going to help you, okay? The next thing you want to do, you want to ask the patient if they can assist. Even if they can just bend their knees, what that does, just by having the patient bend their knees, it eliminates the weight of their lower extremities off the bed, and that's less friction that you're going to encounter when you're pulling the patient up in bed. It also puts the patient in a position where they can help and actually push a little bit. This is even important for patients that are dependent. If they can't actively bend their own knees, see if you can bend them for them. And again, that reduces the drag of their lower extremities on the bed, and it also decreases shearing to their heels. So, we're preserving skin integrity at the same time. What you want to do at that point, you want to gather the slide sheet up. You want to gather it all the way up until you run into the patient, okay? You don't want to be holding on to it out here. You want to get it all the way gathered up. And at this point, you want to spread your legs about at least a shoulder's width apart and kind of offset them a little bit. Okay, one foot slightly in front of the other. And at this point, the movement kind of becomes a weight shift. I also like to hold onto the slide sheet with my palms up and kind of tuck my elbows into my sides, okay? And at that point, you're kind of locked in your upper body, and you have a lot more power in your grip if your palms are facing up, and it becomes more of a weight shift. You're going from your front foot to your back foot. So you're just kind of sliding from this way up into the up the bed, okay? All right, so that's the proper way of doing that task. Couple of helpful hints. You want to make sure again that you ask the patient to assist. Don't assume that they're not able to help. A lot of times our patients are able to do a lot more than we think they can. Use Trendelenburg positioning of the bed. Get that head down and the feet up, if at all possible, if that function exists on the bed. This is especially helpful for our larger patients. You get them in that position, and a lot of times they're able to kind of just shimmy themselves up to the head of the bed, and you're not required to do anything other than push the button to get the bed in Trendelenburg. And lastly, keep yourself in shape. The better condition that you're in, the more flexible you are, the stronger you are, the less stress that these activities put on your body. So they're very physical tasks that we're required to do every day, and the stronger you are, the easier those tasks are going to be. Thank you.